So, Jackie, I'd like to first welcome you. So today we're talking to Jackie Rosen from What's the Difference podcast in Ontario, Canada, Toronto, Canada. And since we last spoke to Jackie, Jackie has given birth to a beautiful baby girl, Hannah, who we're going to see in a little while, which will be lovely. So lots changed for you, hasn't it? So when we spoke to you last, you were about halfway through your pregnancy. And so in that time, you've given birth and you're now at home, early mothering period. So Jackie, perhaps we can go back, rewind a little bit and maybe just talk a little bit first about the last part of pregnancy. How was that for you?
The last part of pregnancy was extremely challenging. I would actually say that my second trimester was the hardest. And that's because what ended up happening was that I never really got rid of a lot of my pesky first trimester symptoms like nausea. And then my third trimester symptoms like swelling of the feet and exhaustion and just overall fatigue everywhere in my body hit really early. So kind of it all merged together at about like 20 weeks. And that's probably the last time I actually spoke with you was when I was about 20 weeks or 21 weeks. And then it took my body like a while to get used to it. So second trimester was very difficult. Third trimester, I had a bit of a honeymoon period between week 30 and week 34 where I felt amazing. And I still was quite nauseous. The nausea never went away my entire pregnancy, but I felt physically stronger between week 30 and week 34. I don't know what it was. I think it was just, I was at the point where I was so used to feeling a certain way and I knew she was coming really soon. And it was like, okay, there's only, 10 weeks left, 9 weeks left, 8 weeks left. And then as soon as I hit about week 35, that was when things got extremely tricky and extremely rough for me. It's physically speaking, and it wasn't my heart condition, which for my last interview, I talked about my congenital heart defect, and that was a big factor in whether or not I could get pregnant. So it wasn't the heart condition. As a matter of fact, the heart condition was unchanged through the whole pregnancy, and my cardiologist was thrilled. Surprised even that I was remained stable. It was my chronic pain that really sidelined me at the end of the pregnancy. And by the end of week 35, I was just crying every day. I was in so much pain. So
can you tell us a little bit about that? Was it pain on top of your disability from the pregnancy, or?
So before, I've had chronic pelvic pain for 9 years now. And as a result of, and I think I mentioned this before, as a result of a bladder infection that went untreated too long. So
you did.
So the nerves in my whole pelvic floor are pretty much shot. And as soon as the baby started dropping, I got those lightning pains, but they were so severe in my case, and they were constant. They did not let up. They were, the only way I could stop it is if I was sitting really, really actually the chairs that I'm sitting on right now in my kitchen island were the only chairs that I felt comfortable in because I felt like it supported the baby from falling out. So every time I got up, the pain was so severe, I could hardly stand up straight. I could hardly get upstairs. I did not anticipate that it would be my pelvic pain that would do me in at the end. I thought it would be the heart condition. And other women I've talked to, I know someone who was actually due with her baby a couple days ago, and she was describing the lightning pains that she was having. And she was like, I can't even imagine how bad they were for you with your chronic pain condition, because she said they're bad enough for me.
That's right. Yeah, a lot of women find them really quite uncomfortable at the end of pregnancy, and that's why they're looking forward to having their baby. Yeah.
Yeah. So it was difficult.
Issues, then it just, I imagine, would have made it in much, much worse.
Yeah, it did.
And so were there any other particular issues that you found in the last part of your pregnancy?
I was ready for it to be done. I'll be very honest with you. I was very stressed. I was still working till about 34, 35 weeks. And then I decided to take mat leave most people will take mat leave like 37, 38 weeks. I decided to take it at 34, I believe, or 35, because I was just exhausted from working, and I was working late every day the last little while, getting ready also to hand over my position to the person who would be filling my contract for a year, because we get a year maternity leave in Canada. I found that the stress, anything that stressed me out, was making things a little bit more difficult, obviously, with the pregnancy. The other symptoms that obviously that were really difficult for me with some of my GI issues were like the stomach issues at the end, the nausea that never went away. And then it actually kind of got better from week 34 and a half. And then week 37 came, and I had a double whammy with the pelvic floor issues, and the nausea came back twice as strong. And I was like, I am so done at this point. But, you know, as uncomfortable as I was medically, I was quite safe. So it was more an issue of I am in so much pain, I can't go on, than I'm in danger, I can't go on. And so it was a very difficult decision when we decided to move up the C-section date to 37 weeks and 3 days.
Yeah, that would have been a big decision to make for you and Dennis.
Yeah, and I mean, it came down to I talked to my OBGYN, and he seemed to think, he was like, well, you know, it's really up to you. He said, we prefer to keep the C-sections closer to 39 weeks if possible. He said, but your daughter's at a good weight. She was already almost 7 pounds by that point, which means that had she stayed in any longer, I would have been carrying around, who knows, an 8 to 9 pound baby by the time I had the baby. And I am, for reference, I'm 4'11". So I'm a very petite person. I already have a concave chest due to structural issues when I was born. I've got no room in my belly for this baby that's getting bigger and bigger by the day. So the OBGYN said that you know, if I wanted to, he would support it. Like at this point, he said that, you know, the only thing was that at this point, a lot of people do schedule C-sections. So there weren't any cancellations, or some people will cancel them. They'll schedule it and then they change their birth plan and they cancel it, or they have their baby early, so they don't need to have a C-section. So he was like, you'll have to see if there's any cancellations. I don't think there's any over the next 2 weeks. Originally, we were supposed to have the baby when I was 38 weeks, 5 days. So then he told me to go speak to one of the assistants who was doing the bookings. And I went to talk to her, and she's like, this was the Thursday. I guess I was 36 weeks, 6 days at this point. And she goes, we've got a cancellation for Monday. That's 4 days away. Could you come in? And I called my husband, and I'm like, are you okay if we have the baby on Monday? She'll be 37 weeks, 3 days. Is that okay? Can we get everything ready by Monday? It was because, you know, 4 days there. It wasn't a long time. And it was kind of like, you know what, if this is what we need to do, then we do it. And thank goodness I made that decision, because my absolute worst day of pregnancy came that weekend before I had her, where I was just so done.
So do you think knowing that you were going to have your caesarean birth on the Monday helped you get through that weekend a little bit better?
Yeah, if I hadn't known, because I was doubting my decision the day after and going, because I had a good day the day after. I'm like, you know, maybe I can keep going. Maybe I should just go back to having it on the original day. And then the following day hit, and I was in tears. I have to be honest, a lot of my memories are blocked out from this whole week now, so I can't remember exactly how I was, but I do know that I spent much of the day crying because I was so uncomfortable and in so much pain. And then at that point I was saying, yeah, I made the right choice. I made the right choice. So, and then the next day by the next day I was running on adrenaline, and I was going, okay, we're getting this done. It's tomorrow. I'm packing my bag. I'm so excited. I've got one goal in mind. And it was that day before was quite incredible. It's again, a lot of my memories now blocked out from that day because I was so focused, but it was a really good day the day before she was born, because I knew that this whole thing was coming to an end, and it was, you know, it was almost done.
Yeah. So for other women in a similar position who are just finding the end of pregnancy really quite hard to deal with, what would you be your advice for them? Like if they knew they were having an induction, or, you know, they had a week or two to go, what would you suggest how they approach that?
Well, I think you have to balance the wellness of the baby versus your own wellness, and you have to take it into account. I mean, my baby was already, we were told she was healthy, she was at a good weight, and that at this point, it was harder for me, the risks, and it wasn't so much the risks of keeping her in, but the difficulty of keeping her in outweighed the risks to her being born early. And also, from what I've heard from other people with disabilities, that they've been told that if, you know, if they're really struggling, if they can make it to 37 weeks, then that's like kind of the spot where you can say, okay, we can have the baby now. It's not, you know, the risks aren't, they're still there, but they're not the same as they would be if the baby was born premature, because you're not premature anymore at 37 weeks, you're early term. So I would definitely say you have to weigh the risks to the baby versus your own health. And, you know, if the risks to you are greater, then for sure talk about a cesarean or talk about an induction vaginally with your doctor. You know, I'll be honest, I did have a lot of guilt around it, thinking, is this too early? Is this too early? Is this too early? And I still feel that way. I think you're still going to feel that way no matter what. If your baby comes before 40 weeks or comes after 40 weeks, I think you're still going to be like, did I wait too long? Did I start too early? Like all this, I think you're always going to have that feeling. But I keep telling myself that, and I had other people tell me that this was what was best for me and her, and that, you know, you have to be a healthy mom to be able to raise a healthy baby, right? So yeah.
That's right. And I think, you know, it's important to think about it in terms of not just physical health, but mental health as well. And I think sometimes for some women, you know, they can feel that stress, increased stress, mental stress towards the end of pregnancy. And so you know, as you said before, it's very much around that balancing up the risks to both you and your baby. Yeah, and deciding on the best option. And I noticed that you talked about the guilt that, you know, you still feel a little bit. And I think, you know, that's one of the difficulties, I think, as parents, is that often, you know, we try and make decisions in the best possible way that we can with the information we have at that time, you know, but we seem to be very good as mothers at putting that guilt back on ourselves, I think. So we have to be very kind to ourselves and remember that it's, you know, we're making the best decision we can at the time.
Absolutely. Yeah. And you know, it's still a thought that I have every day, but I remind myself, and I let everybody else remind me, that I had to do what was best for me in order to be able to take care of the baby. So, and, you know, so that's what I try to do whenever I get that thought.
Great. Yeah. So can you tell us about Hannah's birth?
So Hannah was born on February 8th at 2:50 p.m. Toronto time. And she was 6 pounds, 13 ounces. They had estimated she was going to be 6 pounds and 15 ounces. She's a good size. The birth was very surreal. And I think it was, again, like I said, my memories are I'm one of those people that remembers almost what I did every single day of my life, and what I wore, what I ate, all that stuff. I'm one of those weird cases. The week of her birth and the week leading up to her birth are a total blur. And I keep trying to, you know, remember everything in detail, and I'm having trouble. But the morning of the cesarean was like, let's just get it in and get her done and get it over with. It went very smoothly, the first part, where, you know, I was waiting for them to be ready and change into my gown, and, you know, and they just basically told me what was going to happen. The nurses were great. And then when they took me into the operating room, I started to get a lot of medical trauma, post-traumatic stress disorder symptoms, because operating rooms I've had 5 operations prior to the C-section. And so the last operation I had was a cardiac surgery. And I remember the terror I had as they were wheeling me in, and my parents were called in to calm me down into the OR. They were told to come in and hold my hand because I was such a wreck and so panicky. And the exact same thing happened here. Of course, it wasn't my parents in this time because now I have my husband. So he was allowed in for the C-section, which was great because, I mean, with COVID the way it is right now, it's still pretty bad here. And we didn't even know for sure he'd be allowed to come to the hospital with me. So the fact that he was allowed into the C-section and he was allowed to stay with me the whole time was a huge relief.
That's fabulous,
and
isn't
so,
it?
yeah, so he had to stay out of the room when they did the epidural. And then they were allowed to bring him in after they did the epidural. I was completely going into a state of panic due to my, traumatic memories of this kind of thing. Even though this was so different, they said, what music do you want to hear when she's being born? What do you want? How do you want the experience? What do you want? And so it was like, it was this extremely traumatic event mixed in with all this amazing, these feelings that I never thought I would feel. And so a lot of the C-section is now, again, it's a blur. Apparently my husband was holding my arm down the whole time because I was kind of thrashing because I was so upset and so panicky. I felt, though, I can tell you that I think it's different for everyone, but I felt everything. And I didn't feel like the actual cutting pain or anything like that, but I felt like I had taken about, as I call it, 30 punches to the gut. So I felt them pulling her out. I felt the exact moment she came out of my body. And it was probably the most terrifying and yet the most amazing moment of my entire life. And I never realized that you could have both at the same time until her birth.
Mm-hmm.
And it was absolutely terrifying because I knew that I was awake for this major abdominal surgery, but at the same time, my little baby was being born. And the moment she came out, she was crying. And I think they put her to my face. My husband confirms that they did. They put her to my face and for a few minutes, and then they went and cleaned her up. And I just remember they moved a screen in front of me so that I could watch her being cleaned up. And I was still panic stricken. And I thought this moment of my child being born would be, they put her in my arms. I have this tearful moment with my husband. It gets emotional. No, it was nothing like that. It was me saying, hey, that's my baby. Them taking her back to clean her up, me panicking because they're stitching me back up and I'm feeling everything moving. And then me trying to watch her on the monitor. Well, some of my favorite songs are playing in the background and I'm trying to also go, ooh, what song is this? And there was like a million different thoughts going through my head. And then I was so shaky, they gave her to my husband. And the next thing I knew is that I was really worried about like nausea and all these things happening during the C-section. Everything I was worried about actually didn't happen. It was the pain that was the worst, and the feeling and the actual, the thought of what they're doing to you and feeling the pulling and the punching. And it was just, it was scary. And I was not calming down. And I remember the anesthetist said to me that he was going to give me a drug that might compromise some of my memory. And I don't think it kicked in till later, but probably now the most traumatic thing about her birth is when they wheeled us back to recovery. They put her in my arms. I was completely out of it, so I barely remember this, but she was not breathing properly. And this was probably the scariest moment, one of the scariest moments of my life. Thank goodness I was really drugged for it and don't have too much of a recollection. Because that's basically how my life started, was that my parents noticed immediately that I was not breathing properly. And then 4 hours later, they were told, your child has a life-threatening congenital heart defect, and she might not make it past this night. And so all I could hear was that in my head again. And with our baby, Hannah, who by this point, she had the name Hannah. With Hannah, she just had fluid in her lungs because she wasn't born vaginally. And therefore the fluid wasn't squeezed out of her lungs. I forget what the actual condition is called, but it's the short form is TTN. And so she did have TTN. And they were trying to suction her up and clear out her airways and do all that in another section of recovery. And my husband was off with her. And I was like sitting there shaking and going, what's going on? What's going on? And of course, after a C-section, you shake anyway, because you're still coming off of the freezing and everything. So you're shaking and you're sweating and you're freezing, and it's a mix of everything. And then the doctor came in, and I kept saying, are they going to take her to the NICU? Are they going to take her to the NICU? Because I was a NICU baby. I have a friend who had a NICU baby, and all I'm thinking about is the NICU. And they said, well, we don't know right now. And then later on, the doctor came in and said, we have to take her to the NICU. And I don't know how much I lost it, but I'm pretty sure I lost it at that point, because I'm going, history is repeating itself. My daughter's ill, even though they told me that she was probably going to be fine in a few days to a week. I lost it. And that night was, I don't remember much from that night at all. Again, the drugs kind of erased my memory, but I know I called a lot of people, spoke to them on the phone, was crying, was saying, I haven't even seen my daughter. She's been taken away from me. And it was so difficult, not to mention the extreme pain I was in, and the fact that, you know, when you have a C-section, you're also catheterized, and the catheter caused really horrible pain in my bladder. And I'm trying to deal with all this while my daughter's not even with me. And I just was completely overwhelmed. And yet now a lot of those memories from that night are erased. I go back to my phone and I look at messages I sent the night of her birth, and I'm like, I don't remember sending any of these messages or making these calls. And one of my friends said to me, yeah, you spoke to me on the phone. And she said, I had apparently a very lucid conversation with her, and I don't remember any of it. So it was very traumatic, even though they had all told us that she was going to be fine. She just needed some time in the NICU to clear out her lungs. And they put her on a CPAP machine. And my husband did go to visit her that night. When I was still kind of sleeping on and off, he went to visit her and he took photos and he brought them back for me. And I think, though, the most upsetting thing was knowing that the day my daughter was born, I only saw her for 5 minutes. And so that still haunts me.
Yeah, I think that's similar to lots of women who have a caesarean, particularly when the baby's unwell. Yeah. So, Jackie, you've mentioned quite a few sort of incidences there where, you know, a lot of your own medical history and the trauma that you've experienced throughout your early life and young adulthood has kind of come back with, you know, the end of pregnancy and the birth of your baby, birth of Hannah. So that's not just an issue for you, I think. I think for, you know, for other women with a disability, that can really be quite an issue, obviously, depending on the type of disability, but where they've had a disability that has required quite a lot of surgery, etc. So if you were going to give some advice to other women about maybe what they could do either during their pregnancy in order to prepare for that, what would be your recommendations around that?
Well, what people have told me is to stop projecting. And that's what I've been hearing from my husband, my friends, and because I'm projecting my own fears and onto Hannah, because that's all I know. And I think sometimes, I think for other women, I guess that would be my advice, is not to project. I mean, it's hard when, you know, you struggle to take that advice yourself. But I would say that, you know, that you can have a number of disabilities and have a perfectly healthy baby. There's nothing wrong. Hannah has had some weight issues since she was born. So she lost quite a bit of weight. She was having feeding issues. And basically until today, she was still on the losing end of what her birth weight was. And today she's finally gone above her birth weight. And so we found out, we found the news today. We took her back to the doctor. She's 3 weeks old now. And so I think that, you know, that was her only issue. And still, I even took that and I made it very much about my feeding issues when I was a baby. And so, yeah, I would tell other people that just to remember that, you know, you can have a perfectly healthy baby. You can have all kinds of problems during your pregnancy and still have an amazingly healthy child. And try to remember that, you know, not to dwell on the past so much. Again, like I said, it's hard for me to take my own advice, but you know, to other women, I would say for sure that history can rewrite itself in this case.
Yeah. So do you think, did you have an opportunity to sort of talk about your like PTSD as a result of your, you know, your medical and surgical background during your pregnancy? Do you think you had an opportunity to talk with your caregivers about that and how that might affect you?
I think that I was going obviously while I was pregnant, my biggest worry was my my nausea because I had the fear of vomiting. So I was very fixated on that. And then I was fixated on, you know, the next one would have been the heart condition, was like, is my heart going to be okay? And so I didn't really think about so much about the trauma of going into surgery or anything like that. I was more worried about going into a natural labor and how that might even exacerbate my pelvic floor symptoms more than they are. And that's why I chose a C-section to begin with, was because of the pelvic floor issues. It wasn't because of the heart condition. So I was just, at this point, I was like, I'm going in for surgery, but this is going to be a great surgery because I'm going to have a baby at the end of it. And I wasn't thinking about the impact of medical trauma at all. All I was thinking about was my triggers. I was going, okay, well, what if I throw up during the surgery? Well, that never happened. What if I get a UTI from the catheter? Well, that never happened. You know, these little things that I was focused on, but I wasn't focused on the big picture. And so I didn't really address it before going into surgery. And I wish I had, because, and that would be my advice to other people, is to try to address it before you go in, because now unfortunately, I'm more traumatized by what happened. And even though nothing bad happened, in the end, what happened to Hannah happens to a lot of babies, and she's still healthy and she's strong and she's got a great start to life. But I still see that as trauma. And I think, you know, I think it's best if, definitely, that people should be addressing this before they go in to prevent further trauma. So, yeah.
Yeah. And I think the thing is that trauma is defined by the person themselves. What's trauma for one person might not be trauma for somebody else. And yet, you know, their trauma isn't seen as trauma by somebody else. So, yeah, I think it's very much individual. And I think that's, you know, that's the thing that we have to take into account, isn't it? Is that respecting that somebody's trauma is how they view it. We can't actually put our own values onto that. Yeah.
No,
Well,
absolutely not.
I hope that you get an opportunity sort of over the next few months as you settle into motherhood to have opportunity to debrief about that, perhaps with one of your caregivers, or perhaps one of the nurses that are coming to visit you or care for you, so that you do have an opportunity to sort of pull apart what happened and try and make it less traumatic, you know, so that you're not carrying that trauma on with you.
Yeah, and the other thing is too, is that I am still seeing my psychotherapist regularly. I'm seeing her once a week right now. There are some signs that I could have some postpartum depression. So I've been referred to a clinic separate from the hospital I gave birth at, just because I have too many traumatic associations now with that hospital. So I was referred to a different hospital. So I'm watching for that as well, because I'm not considered a high risk for postpartum depression, but I have signs that it could be happening. So, you know, I'm constantly talking to people. I'm trying not to cut myself off. I think the first few days, it was very hard for me to talk to people. And now if my friends are messaging me, I'm trying to message them back right away. I'm trying to do some normal stuff that I still did before I was even pregnant, to try to make myself feel more, you know, feel more normal, and yet still this new life that I'm adjusting to. But as far as the trauma, just going back to your original question and what we were talking about, the way that I intend to process it is through doing stuff like talking to you. I'm going to be talking about it on an episode of What's the Difference podcast coming up. It might have already dropped by the time people see this. So I'm going to be talking about that. And I'm also going to be writing about it in my blog. And I feel like by writing about it and speaking about it, it'll be less traumatic and more like, okay, this is what happened. I can look at it logically now, if that makes any sense.
Definitely. Because I think through that process of talking about it and also writing about it helps you put your own feelings and the emotions into a little bit more perspective, and you know, you work through them at the time, don't you, as you're actually doing it, as you're talking about it and as you're writing about it. So
absolutely.
I guess, and I guess the thing is you always have to choose your time and place, don't you, for talking about it, so that it, you know, because you need to, it's important to recognize that sometimes even just the talking about it actually can bring up the feelings of trauma again. Yeah.
Yeah. I mean, it was hard with me going over the details right after her birth. It was very hard for me not to cry while I was talking about it, because every time I've tried to talk about it, I burst into tears. And, and when you're dealing with postpartum hormones to begin with, and then you're dealing with trauma, it's all mixed in together. It is so hard to cope with. And my manager, who's actually I spoke to immediately after she was born, he previously worked for a mental health hospital. And so he was telling me that the 5th day postpartum is a very, very difficult day, and to expect that it's going to be a struggle. And as it turns out, my 5th day postpartum was the worst day. I was in tears the entire day. And it was a combination of being over the moon in love with my daughter, but also feeling horrible that she was no longer part of me in my body anymore. And the memories of the surgery coming back and the memories of the trauma. And it was just, I just sat the whole day, and I was also in severe pain. My pain wasn't managed appropriately after the C-section. So the combination of all these factors, I just was weeping the entire day. And I figured, okay, once I can get past day 5, maybe things will be better. And they have gotten better, but it's hard. It's very hard. And the other thing I want to mention too is because the projecting thing is going on when I see like Hannah feeding, and she's mostly being bottle fed, formula fed. And when I see her feeding and I see my husband feeding her, I'm worried that, oh my God, if I feed her, what if she doesn't take food? Then it's like me, and then she's going to have all these issues with nutrition like I did. And so sometimes I'm terrified to feed her because I'm afraid that she's going to have issues too. And again, this is something that I'm going to be working on as my husband eventually does have to go back to work, and I will be her primary caregiver during the day. So this is something that I'll be working on as well with my therapist, and talking about some of those fears, because she'll be relying on me for everything, or almost everything, come the end of this month. So yeah.
And I remember you've talked about that you had a doula who was supporting you through your pregnancy. So since you've come home from hospital with Hannah, has your doula been coming to visit you at home to sort of help you with some of those things, or how has that worked out for you?
She's been doing all virtual because we're still pretty much in not a great situation in Toronto. We have limited our interactions with people in person to very few people. And if our doula absolutely needed to come over, we would have her over. But right now she's been doing all virtual meetings with us. And she has been very helpful. Yeah, it's been very good virtually. She's been great. And sometimes she's just around as an ear, as a listening ear. And you can just drop her a note and be like, I'm frustrated about this. And she just listens. And that's been pretty awesome. So she and I have had, I guess she and I and my husband have had, I think 2 or 3 meetings after, or at least, and then if I'm not in the mood to update her on stuff, he'll update her on stuff. And so she's been great.
Fabulous. So how long is she going to support you through the postnatal period, Jackie?
I'm actually not sure. I am actually not sure. I don't know. But I think probably at least a few more weeks, I would think. I don't know.
Yeah, great. So you've got a couple of people there really then who are supporting you. So you've got your doula, you've got your psychotherapist, which is great. So because it sounds like some of those, I guess those trauma issues are some of the main issues that you need to be working on.
That and the fact that you're taking care of a new baby and you're a new parent to begin with. So my mother-in-law has also been helping us out a lot. She's one of the few people that we have let over. She's one of only, I think, 2 people that we've let come over to our house.
Yeah.
Other than my parents, but my mother-in-law has actually made the time to come over and help us out. So she's been very helpful with Hannah, and is kind of, stays with us 1 to 2 nights per week just to let us have some sleep. Because right now, my husband has been amazing looking after Hannah overnight. Well, he lets me sleep, which is, I can't thank him enough for that, because if I don't get enough sleep, my anxiety gets way worse. And then I feel way worse. And I'm still recovering from major surgery. And something to remember is that if you do have a C-section, it is major abdominal surgery. It's not, I think I had this idea that, oh, it's a nothing surgery and I'll be fine. And, the painful part ended, even though it was awful, it ended about 8 to 9 days later. I felt a great deal better, but it's still major surgery and you have to take care of yourself. And as my husband said, you did the heavy lifting for 9 months. You did the pregnancy. You had a rough time. You went through surgery. So now it's my turn to take care of her. And I'm so thankful for his help. He is unbelievable. He is so amazing. So he's my rock right now.
Yeah, I certainly imagine that, Jackie. Yeah. And it's, that's really important, isn't it? I mean, it's a partnership in bringing this beautiful little girl into the world. And it sounds like you're both doing an amazing job of looking after her.
Yeah. And I mean, and it is, you kind of have to, it's kind of your relationship in a new way too. And you have to develop this kind of new way of communicating. And sometimes it is hard. And there's been some days where I've been sitting crying and he's like, you have to just keep going. You have to keep going. And it's hard, but you know what? I know that things will get better and things will get easier the further I am away from the day she was born and the further she is away, and she becomes a little bit more interactive and she starts being able to pick up on cues and all that. And I mean, she's already quite, I don't have any experience as a parent before, but I'd say she's already quite advanced for a 3-week-old baby. She's picking up on cues already, and it's amazing to see it.
Yeah. I mean, babies do communicate right from the time they're born. I think it's just that we often don't recognise or pick up on those very small cues, that they're showing us. Yeah.
The other night when she, for the very first time, she grabbed my arm when she didn't want me putting her down in the bassinet. And I almost started crying and melting when she grabbed my arm, because I'm like, oh, she doesn't want me to put her down. She wants cuddles from her mom. And I just got very, very emotional about that, because it was the first time that I really felt like she needed me.
Yeah. So on a day-to-day basis, how do you feel like you're managing at home? I guess one of the difficulties is that, with COVID, as you've said already, you're limited as to the number of people that you can have and the opportunity to sort of go out and socialise, which I think for so many new mums is often a really good support. And so that's been quite difficult, I think, for a lot of mothers, who've had babies during this time of coronavirus. Yeah.
Well, it's interesting because I know that I was part of a group that the hospital that I gave birth at was putting together about women who were pregnant having fears about COVID. And they kept saying, oh, this is such a great time to have a baby because you can't have people over. So it's about you developing that bond with your baby and not having any oh, sorry about that. I'm sorry about that. I'm going to start that question again. I'm going to start from, hold on.
Yeah,
3.
we're just talking about the I guess the implications of having to stay home with COVID at the moment, how that affects new mums. And you were talking about the hospital group.
Yeah, so when the head psychiatrist was talking about how this is a great time to have a baby because you have no distractions and you're home alone with the baby and there's nobody coming to help. And I was thinking, no, it's not. It's actually not, because as much as, I don't want a revolving door of people coming in and out of my house because I don't want her to be exposed to germs. It's also, those essential people like my own parents who are high risk of COVID. So we can't, they're being very careful. My friends who want to come over and see her, but they can't because they have kids in school and that we can't possibly expose her to anybody who's been at school. And so it's actually been very difficult. So I don't agree with this. This is a great time to have a baby. It's a hard time to have a baby. It's a very hard time. I'm not saying it's not a good time. It's just you have to be prepared that it will be harder because you don't have that support network. But the other thing that I would tell people is, you have to assess what your risk is. And if you need the help, you need to ask for it, because don't say, oh, don't say, just sit there and not accept help. If, as long as you assess it and see if it's safe for you and your family, if you know it's a person who for example, hasn't been taking public transit, hasn't been around a lot of people who could have possibly been exposed to COVID-19, then you have to weigh again the pros and the cons. Should I have this person over to help? And so I think that, it is important to kind of have 1 to 2 support people in your back pocket that can come in and help you, because it's really, really hard with nobody else. Like I said, my husband and I couldn't have done it without the help of my mother-in-law. Absolutely not. This would have been nearly, it would have been very, very difficult, especially that first weekend with me being home from the hospital and not being able to move. So, yeah.
Yeah. So I think, new parenting generally can be quite stressful and a time of anxiety, but, you've added to that the layers of the fact that you've had a baby during the COVID pandemic, and then added to that, you've got your own disability issues and, your previous trauma that you've experienced as a result of that, and kind of you're adding all of that to the pot. So it really does, I guess, increase some of the stress for you as a new parent. Yeah, definitely.
Yeah, it does for sure.
Yeah. But as you say, it's about sort of weighing up those risks and recognizing sometimes that the emotional risks of not getting the support in can be actually a lot worse than having somebody come in, with obviously the appropriate kind of screening, making sure they haven't been unwell in the last, 2 weeks. Absolutely. Or they haven't been in contact with other people. Yeah.
Yeah, you have to weigh the risks versus benefits, and like I said, in our case, I've actually become a little bit less paranoid about COVID, because it's like, okay, well, we have to do this. We have to go to the grocery store and get formula. We ran out, like, we can't avoid it. We're very lucky that we live in a condominium. We have a condo townhouse on the ground floor of a building. We can leave. We have a front door right on the street. We can leave and go to the drugstore, which is on the other side of our building, and get formula for the baby, bring it home in like 5 minutes. And then our doctor's office, where we've been taking Hannah for regular weigh-ins and for regular checkups, our doctor's office is in the ground floor of a grocery store. So that also helps, because while we're there, we just be very careful. My husband will run upstairs and pick up groceries. I'll stay downstairs with her in the hallway where there's lots of fresh air and people aren't lingering, or I'll take her to the car and I'll sit with her in the car until my husband is done shopping. And so we're lucky that we've had those resources there, and those are the only things we've needed so far, is the doctor, the grocery store, and the pharmacy. So it's been actually very, very good. And we're lucky we live in a very built up, high density area where there's lots of services. So it's easy to get what we need, and having like the pharmacy, the drugstore right around the corner from us really, really, really helps when we need any baby stuff. It's open. We just run over and get it in 5 minutes. So that is a huge help. But again, we had to weigh the risks with the benefits of, like, should we be running to the drugstore every 5 minutes, or every day, because that is upping our risk, but it's a risk that we have to take, unfortunately. And for us to call a friend to come all the way over, most of our friends do not live in this area. So for us to call a friend to say, come on over and shop at the drugstore for us, when it's right around the corner, it's like, it doesn't make sense, right? So yeah. So it's balancing that all out.
Yeah. So, Jackie, can I just sort of go back to thinking about how your disability has impacted on the postnatal period? I mean, we've talked quite a bit about your sort of the history and the post-traumatic stress and the difficulty surrounding your birth. But in terms of like recovery, like physical recovery, how do you think that has been, impacted by your disability? Do you think that has made it more difficult for your recovery, or do you think your recovery has been kind of pretty much standard on course for recovery after a caesarean birth?
I think it has been more difficult, to be honest. I think my heart is feeling it more now than it did when I was pregnant. The exhaustion is coming in now. And I can feel I'm out of shape. And so the other day we had a really nice day in Toronto. It is our winter right now. So we had a really nice day, and I had a coworker come over for a socially distanced walk, and we both wore masks, and we took the baby around the corner in the stroller. And we literally did just a loop of the block in this area, which would normally take me 5 minutes. And it took me at least 10. And I was huffing and puffing by the end of it. Now I'm pushing a stroller for the first time. And it was my first time pushing the stroller outdoors. But I could tell, like, this is not me. Like, this is definitely, I have a lot of work to get back to where I was, physically speaking. So it's been it has been more difficult. My heart feels a little different than normal. Like, it feels like at night it's beating differently. And I don't know if I felt that way after my last surgery, which was a heart operation, but I don't know what that is. I don't know if it's psychosomatic or what, but it feels different. So I think that I'm definitely taking, not necessarily a bit longer, but it's just a little bit harder for me. And like I said, the fatigue is just really bad. I also have a low pain tolerance. So I've been dealing, like, even though the main pain from the surgery is gone pretty much, I'm still really, really sensitive. And every time I have pain in my stomach, I get a little bit freaked out. And especially because I had a feeding tube for 10 years. And where that feeding tube was stretched out during pregnancy. Hannah was kicking it all through the pregnancy. She was kicking where my stomach tube was. And I could feel, it felt like almost phantom, like it was still there. And so my whole belly is very, very sensitive right now. And it's, again, part of it is mental, but when the doctors would try to touch it in the hospital, and even when my family doctor tries to touch it now to just, to check up on me, I jump. Because I'm expecting like someone's going to take out my stomach tube or something like that. And I know that the stomach tube now hasn't been there in, gosh, I think 15, 16 years, but I still feel it there. And so it has impacted my recovery, and the fact that I am more sensitive in the area where I was operated on, just because also when my stomach tube was taken out permanently, and they had to actually go in through a laparoscopic surgery to close the tract where the tube was. So I had incisions all over my lower belly from that laparoscopic surgery. And I think that the C-section cut across some of those, or cut near some of those. So I'm still very, very sensitive there. As far as though when I'll be getting a checkup, I believe my cardiac checkup will be 6 weeks postpartum. And then I have a 6-week postpartum with my OBGYN, but interestingly enough, that is virtual. They are not doing any in person right now. So I'm wondering, if you have issues, are they actually going to bring you in? Like, how are you doing this kind of appointment virtually? But we'll see.
I'm sure they would get you to come if they identified any particular issues that they were concerned about. Yeah. Mm-hmm. And Jackie, you talked about part of the reason that you brought the caesarean date forward was because of the pelvic discomfort that you had. So how has that been for you since you've given birth to Hannah?
Oh my God, so much better. It's unbelievable. It's not a complete reversal at this point, but it is livable now. And those last few weeks, it was impossible. So there's still some bladder issues, but from what I've read, they're more along the lines of normal postpartum bladder issues than they are a result of the chronic pain. And so I'm not too worried about it right now. All I can say is that it's finally, I can walk around without worrying that my bladder is going to fall out, or that somebody's stomping on it or kicking it. And it's the relief immediately was incredible. So I almost went back to, I would say I was back to 80 or 90% the day after, as far as once she was out, the bladder stuff, and once the catheter was out, the bladder stuff just got 90 to 89, 90% better immediately.
Well, that's been good. So that's been a positive, hasn't it?
Oh yeah, it was.
Amidst some of the other issues, yeah.
Yeah, and the other thing that got better too was the nausea didn't go away immediately. And then I started reading about, because I had started a little bit of breastfeeding at first, and then she kind of wasn't, Hannah wasn't doing well with it. So I was like, no, you know what, we're not going to continue with this. She's good on formula. And when the milk first came in, the nausea hit back to where it was first trimester. And I was going, oh no, this is not happening again. Luckily, it was only bad for 3 days. And then it just went away. And now I am proud to say that after 9 months of taking nausea medication every single day, I have now gone a full week without taking nausea medication.
Yeah. That's great. Great news.
It's amazing. It feels amazing to not be nauseous anymore. I can't tell you how much I appreciate it now. How I was almost worried that it was never going to go away, and now it's like I'm almost back to my normal.
Yeah. So it's certainly been a life-changing event, hasn't it, for you? I mean, I think for every new parent it is, but you've had lots of other issues on top of that.
Yeah, and kind of, I think in the end, what I kind of can't wrap my head around is these last 9 months, because now it has been just over 9 months since I became pregnant, and Hannah was 2.5 weeks early. So I'm looking back at it now, and as hard and as difficult as the pregnancy was, I'm now, and this is, again, and every woman tells me this, even women who've had difficult pregnancies, is that they miss it in the end. And part of me really does. My hormonal part misses it, because I miss her being attached to me. I miss her kicking. I miss, that excitement and that anticipation of this is going to be the best thing that ever happens to me, and all that. And now it's kind of like I'm completely disconnected, and she's not part of me anymore, and she's her own little being. And so that part of me really misses pregnancy. The rest of me does not. The rest of me is like, I'm so glad it's over. I'm like, never doing this again. It was awful. Yeah, it's been quite the journey. And as I've said, like, I think finally about a week after her birth, I just sat down and I was like, I can't believe I did that. Being pregnant was one of my biggest fears, was one of my biggest worries, medically, mentally speaking. And I cannot believe I just went through a 9-month pregnancy, or an 8.5-month pregnancy, went through a C-section, did all this to have a kid, and I had a kid, and I had a healthy baby. And I cannot believe that this happened, and this is amazing. And I can't believe I was strong enough to get through this.
So for perhaps other women who have a disability, not necessarily the same disability that you have, Jackie, but perhaps other disabilities, and they're very tentative about having a baby, even though they might desire to become a mum, but they're tentative about the implications of that. What would you say to them?
I would say that if I can do it, anyone can, because I was so terrified of being pregnant. Absolutely terrified. It scared me. It was my worst fear for about 10, 11 years, is that I always wanted at least one kid. But I didn't know how I was ever going to get there. And, originally there is enough legitimately that, physical issues, that I had a reason to go through surrogacy, to go through adoption or another method, but I also had enough of a reason to go through pregnancy. And it was just so hard to get myself to that point. I think that, first of all, it needs to be the right time. So you need to be mentally ready. So if you're tentative, if you really want a baby and you want to go through pregnancy, you want to try to get pregnant naturally, but you're scared, give yourself some time, talk to your medical experts, talk to a therapist, because there will always be a mental health issue, like a mental health component to this, because you have to be mentally ready. Give yourself the time. I was worried at 31. I was like, I need to be a mom now. Well, I didn't end up becoming a mom till this year. And this year I turned 37. So I would also say, like, don't rush it just because you think you're running out of time. Women are having babies well into their 40s now, and it's not abnormal at all. So I would say, wait till you're ready. Don't rush it. If you're not ready to have kids, if you want kids, but you're not ready to go through pregnancy yet, wait it out. Talk to people, wait till you're ready to take that step. But again, I would say if I could do it, then literally anyone else can get through pregnancy if I got through it. And the fact is too, is that for women who have a disability, who have, special needs otherwise, that things will be different in a good way. And that is that the doctors will care about you. they're not just going to care about the baby. They're also going to care about your well-being, because if you're not well, then the baby's not well. And so you have to be well. And so the doctors will, like, you'll be able to stay on certain medications that might, otherwise healthy women might be told you can't take those medications. For people with disabilities, you can stay on those medications. You weigh the risks, you weigh the benefits, and you make a decision. For example, one of my medications for my pelvic pain, amitriptyline, most doctors have told women to stay off of it. You can't have it if you're pregnant. My doctor said, you're absolutely fine taking it. It's such a low dose, don't worry about it. I stayed on it the entire pregnancy. Had I not, I wouldn't have been able to get through it. So talk to your doctors about what medications you can stay on, what medications you have to go off. Chances are there's a lot of things that you can take during pregnancy that you didn't think you could. And there's other things too, is that another thing to remind yourself of is you don't have to do everything perfectly. I mean, back in the day that I was born, women were still smoking and some women were drinking during pregnancy. And I'm not recommending that anybody do that. But like one small thing, like if you have to take a certain medication one day, you take that medication. If you need to eat a certain food, eat that food, as long as it's not going to be like absolutely, something that's going to harm the fetus. There's many things that you can do to accommodate if you, and in some cases, I know, like my healthy friends have been told you can't take Tylenol while you're pregnant. You can't take acetaminophen. I mean, in my case, I was told you take painkillers. If you're in pain, you take that. You take it. Like, we need to have you healthy in order to have a healthy baby. So it's just all about moderation and kind of talking to your doctor, talking to somebody for mental health, a counselor or anything. And I think that, if you do your research ahead of time, if you get yourself mentally prepared, that anybody can, as long as you weigh the risks, and I'd say go for it. Absolutely go for it, but just wait till you're ready and don't do it a second before you're ready. Just do it when you're ready. Don't rush it.
Yeah, that sounds like really good advice, Jackie. Thank you. Okay, so Jackie, is there anything else that you'd like to add or to talk about today?
Perhaps. Well, I think that I have to make an introduction here. So this is Hannah right here. There she is.
Oh, hi, Hannah.
Say hi. Say hi.
She's a gorgeous little girl. Look at her.
Yes. Yep. And I put the bow in her hair. I had to put the bow in her hair because I have to, mommy wears things in her hair, so does Hannah. So yes. Yeah, she's just been beautiful. Fed. She's stretching out now, and she just wanted to say hi, and now she's going back to daddy because she needs a diaper change. So daddy's going to change her diaper. So yes, that is Hannah.
And that's very important for everybody to meet Hannah. Of course.
3 weeks old. 3 weeks old today, and has now surpassed her birth weight. So she's now back to her birth weight and above, which is great.
Fabulous girl. Yeah. Thank you, Jackie. So just before we finish, is there anything else that you wanted to talk about?
Well, just to mention that I will be talking. Well, I was just going to actually say that, that I will be talking about this experience on my podcast, What's the Difference podcast.ca, for anybody who wants to check it out, and as well as on my blog, JackieRosenToronto.blogspot.com. If you want to read about the experience, it has not been published yet. It's going to take a while with a newborn baby to write this, because I know it's going to be probably about 10,000 words at the rate I'm going. So it's going to be a long post, but if anyone wants to check that out, again, it's JackieRosenToronto.blogspot.com. You can read some of my other stuff there as well. I wrote about, I think I had my last week of pregnancy, I wrote a whole long post about, about my pregnancy and how it's been different from other people's pregnancies. And so if anybody wants to check that out, they can do that.
Yeah, that'd be great. All right. Well, thank you so much, Jackie, for talking to me and Disability Maternity Care about your last part of your pregnancy, Hannah's birth, and the early days at home. And we wish you lots of happy parenting and memories with Hannah. I think that's, they're memories to take, through the rest of your life and to share with Hannah as she grows older.